Hi, I'm Dr. Greg Sheppard. Today I'm going to talk about canine vaccine titer and vaccine titer testing, the reasons for it. Generally speaking, we will, at my practice, Sheppard Alternative Animal Care, recommend or prefer performing vaccine titers over routine booster immunizations if at all possible. Generally, the three core vaccines that most dogs are going to be vaccinated for would be a combination canine distemper virus, canine hepatitis or adenovirus, and canine parvovirus. We do also vaccinate for canine rabies. We can perform titer levels to measure a body's immune status or antibody levels to a particular virus, and the purpose of drawing or measuring these antibody levels is to ensure that a patient has a sufficient amount of circulating antibody or protection against exposure to potential viral infections. Vaccinations can afford or help to promote the development of antibodies to particular viruses as well. Generally speaking, over time, we feel that vaccine titers are more appropriate because oftentimes the vaccinations that we administer to our canine patients can afford them immunity or antibody levels that are sufficient for protection for oftentimes years past, which generally recommended as a routine booster interval. That being said, a vaccine titer is a simple blood test. A blood sample is drawn from a patient, and then a test is performed on these levels to see or measure the amount of circulating antibodies to a particular virus. If those antibody levels are deemed or found to be substantially high, there should be an indication that the patient has sufficient level of immunity and then or therefore has protection against exposure, natural exposure to those viruses. That being said, immunizing a patient can afford immune levels as well, but again, once we introduce repetitive vaccinations, that too can have sometimes unwanted or deleterious effects to the immune system. So vaccinations are generally not recommended here as often as, again, titer testings are, because if we can achieve or find that a patient has a sufficient level of antibody formation or at a sufficient titer level, that patient should be protected and may be protected for an extended length of time. We will generally want to vaccinate early as puppies, oftentimes reboostering them once before we find or see where a titer level is, but sometimes even one single vaccination can afford them immunity. Once we do test, generally a test is performed about 4 weeks following a vaccination to see if a sufficient antibody production has been made.